So I put together a quick PowerPoint for this today. I'm just going to talk about injury prevention basics, but I think there'll be some take homes, some good nuggets in here. All running injuries are essentially overuse injuries, aside from like ankle sprains. So in essence, they can all be prevented, but that's easier said than done. We all have a tendency to get hurt as runners. It's a very high risk sport. Up to 85% of runners will experience a running related injury a year. So that equates to about 38 injuries per 1,000 hours of running. About 50 to 75% of injuries are overuse in nature due to the constant repetition of the same movement, whereas the remainder would be more acute, like strains. And there's up to a 70% recurrence rate of injury with those who are previously injured. So we all tend to have one or two things that tend to manifest themselves again and again. They may go away and something else pops up, and that's because of us as individuals, we're all different, and so we're all susceptible to our own little things because of the way we're designed and built. So number one cause of injury is our training errors. Beware, these come in many shapes and sizes. Training errors are essentially just decisions that were made that didn't respect your body's physiology, your body's ability to recover, your body's ability to heal and take care of itself. With all injuries, really what we're trying to do is facilitate healing. Your body knows how to heal itself when it's hurt. So we want to facilitate that. Injuries happen when you don't facilitate recovery enough, where something starts to creep up, and if you don't have experience with that particular pain, then you may make a bad decision in terms of running on something again that you shouldn't be. Obviously, running hurts. There's a lot of things that you can run through, but training errors essentially happen when we push through things that we shouldn't be. I try to talk about this acute chronic workload ratio whenever I'm given the opportunity. I think I've gotten good feedback on it. This is based off of a research study. Let me preface this by saying, we're all probably comfortable with tracking our weekly mileage, and we all know we've all probably heard that you shouldn't increase your mileage by, some people will say 10%, some will say 20%, some will say 30%. That's because those numbers come from research studies where we know that there's a clear increased risk of injury at 30% increase in mileage per week or more. There's also some studies that show that 20% is an indicator, and a couple is as little as 10. But we know that there's a line, right? We know there's a threshold at which your body can't recover, and it gets hurt. There was a novel research study that I like because it incorporates intensity, which I think is very important for this class, called the acute chronic workload ratio. And if you look at that little equation on the right, all the acute chronic workload ratio is your workload or volume for the past 7 days, that's the numerator, over your average workload for the past 4 weeks, that's your denominator. So this workload takes into account intensity. So you can't actually come up with a number. Let's say we're all running 20 miles a week, but 15 of those miles are I'm sorry. So let's say we're running 20 miles a week, and 15 of those miles are easy, and 5 of those miles are at intensity. The 15 miles, let's say those count for a unit of 1, and let's say the 5 intense miles count for a unit of 2, because they're more intense. So that would put your volume not at 20, but at 25. At any rate, it's just a way to kind of think about how intensity may impact your volume or your workload more. But the take home from this ratio is that if this ratio should be about 1 to 1. And if you're increasing your workload or trying to run more or trying to run faster or more days, you need to keep that at 1.3 or lower. That's about 30%. The research is in this research study showed that if you increase by greater than 1.3, you're 2 to 4.5 times to get hurt within the next 2 weeks. So again, the reason is that you're not recovering well. So to say that again, if you increase your workload by more than 1.3 any given week compared to the last 4 weeks or more, you're 2 to 4.5 times more likely to get hurt. And I'd certainly see that clinically after races, after incorporating speed work. There's some things that I would be very careful of during speed work, which I can talk about when it comes to form and effort to avoid this spike over being over 1.3. If you know you went over it, you just need to respect the next couple weeks. A lot of runners will go do races, back-to-back weekends or back-to-back days, or like the tuna run or something like that. You're clearly going to go over 1.3 with those big weekends. And we have this mindset that we came through that weekend unscathed. But this research would tell you that you're actually more likely to get hurt over the next couple of weeks because of what you've just done. And it's because you haven't recovered. So it's just a different way to frame your mindset. So the characteristics of uninjured runners, and the next slide is going to be characteristics of injured runners. This is just a list that I've compiled generally over the years treating injured and uninjured runners. I see a lot of uninjured runners as well for maintenance work, needling and body work. But so consistently with uninjured runners, there's research to back this. We see good run form. What does good run form mean? Well, essentially the runner you should perceive them as being effortless. There's different variables that we can manipulate, and you're going to get a lot of people that have very strong opinions on different aspects of run form, but the result should be effortless. And the reason is that with effortless run form, we have a low load or a low force that the ground is pushing back against you. We get hurt because we hit the ground and the ground hits back at the same force. So you want to have a run form that has a low loading rate and a low peak load, particularly for endurance running. Uninjured runners have a large base consistently, and they have consistent volume. If you think about that workload ratio for the last 2 to 3 years, they've probably been at about 1 to 1.2. They don't do a lot of different things. There's not a lot of variability because they've been so consistent. They may be running a lot, but they've been consistent with it and they have a big base. The result of that is that their bones, their tendons, their ligaments are resilient. As runners, our cardiovascular system, our nervous system gets better and stronger quickly, and it gets better and stronger a lot faster than tendons, muscles, ligaments, and bones. So you have to respect the musculoskeletal system when you're getting faster because it's not prepared for what your cardiovascular system can do oftentimes. These uninjured runners don't race too much. If you look at professional runners, depending on their event, they don't race very often. So you can kind of take that their race schedules and kind of look at it and glean from that. They're consistent with their prevention work, and they prioritize manual therapy and recovery work. Characteristics of injured runners: a small base, not a lot of volume in their background, too much too quick. They've gone over that 1.3 ratio, too many races, running too fast. That's a big one. We're all guilty of, most of us are guilty of that, myself included. We don't like to do the slow, easy workouts for the most part. Plyometric boot camp style workouts and half marathon training, with those coexisting. I see a lot of injured runners that may have two goals in the fall. They want to train for a half marathon, but they also want to do plyo 3 days a week. There's nothing wrong with plyo. Plyo is great, but when you're going to boot camp style workout classes and your goal is to get as fit as possible there and train for a half marathon and squeeze that lemon, those two things don't coexist very well. I see a lot of people that are hurt that are trying to do both of those at the same time. Doesn't mean they can't exist, but you just have to be careful with your volume. And pull back a little bit on the intensity in those plyo classes, focus on form that sort of thing. The other thing that we like to say as PTs is they only come to PT when they're hurt. We are here for prevention as well. Insurance will cover preventative work. What type of runner are you? So this kind of comes from my brain over the years. Let's say I have an N of, I don't know, 20, 30,000 injured runners, right? And so over the years, with me doing an evaluation of those individuals, feeling flexibility in the hip, the ankle, hamstrings, the hip flexor, feeling strength, I start to get this pattern of like the general population that I've seen. How strong is this individual? How flexible is this individual? One of the things that's really important to understand as a runner is, I think, where you fall on that bell curve in terms of mobility. Are you very flexible? Are you very tight? They're both fine. They're both normal. You may have somebody that's very flexible and somebody that's very inflexible. They're going to, in my head, they're going to be on different ends of that bell curve. And so from a prevention standpoint, from an injury prevention standpoint, knowing that about yourself, you can then incorporate exercises and preventative work for you, not, because you're really, really inflexible or because you're really, really inflexible. So people that are more tight, like myself, more inflexible, they're generally more stable. So there's certain injuries that we're not prone to. Patellofemoral syndrome, which is a classic knee pain in the front. I'm not really prone to that, but because I'm tight, I'm more prone to strains like hamstring strains, IT band friction syndrome, compression type injuries. A really flexible individual may be more unstable. So their muscles have to work harder. They may be strong, but they need to be stronger than somebody that's really tight because they're prone to, because their joints have more collagen in them, they're more flexible, they're more unstable. So the classic flexible individual is the flexible female. They're good at stretching, they like to stretch. I would encourage that individual to foam roll and strengthen their glutes. That's the best prevention stuff you can do. So those individuals are more prone to knee pain, high hamstring syndrome, piriformis syndrome, injuries that require stability. So the next couple slides would be like prevention exercises that pretty much everyone could, particularly in a class where you're working on speed. Mobilizing muscles. When you hear the word mobilizing, what I want you to think is deep tissue, trigger point, dry needling, active release, scraping, massage, get your foam roller out, get your ball out. The most common exercises we give are foam rolling. You'll find PTs that are, very opinionated on foam rolling one side or the other, but it does work. The most common muscles that you should foam roll being the glutes, your backside, okay? This is the most common exercise we give. We give it in all different shapes and sizes. We have a YouTube channel with, I don't know, there's probably 150 exercises on there now, but there's a bunch of foam rolling videos. Foam rolling the glute max, the glute med, your piriformis, your TFL, that stuff works. You could use a roller, you could use a ball, you could use a trigger point ball, 3-inch or 5-inch, it doesn't matter. Your job is to seek and destroy when you're foam rolling, okay? If you're not comfortable with it, it's because you haven't practiced enough. Get on a ball, get on a foam roller, it doesn't matter what you use, and find those sore areas and work them out. If you come into PT and I do recovery work on you, I'm gonna find those spots that hurt. We have the ability to find those, that's because they're taut, they're tight. So you can release some of those to a degree, and that helps. Hamstring release, this is a good one to do. I incorporated this. I don't give this a ton, but I do see a lot of hamstring tightness, or the perception of tightness in people that have been doing a lot of speed work. That's because we have a tendency to overstride when we get fatigued, and that puts a lot of strain on the hamstrings. The hamstrings are very vulnerable when you're incorporating speed work. So I don't know what that little H is there under hamstring release, but at any rate, you could get a trigger point ball, a 3-inch trigger point ball, or lacrosse ball, take it to work, put it underneath your hamstring like Aaron's doing here. Find that areas that are sore and then extend your knee and bend your knee. Extend your knee and bend your knee. What you're doing is kind of pinning that muscle down and then working it out. So a hip flexor stretch, if the hip flexors are not being stretched out, you don't need to do this a lot, but you need to do it consistently. If they're not being stretched out, they're prone to becoming strained, but also tight, and that can cause overstriding, which can cause hamstring issues. So this is an important exercise that I think every runner should be doing to some degree. This is a general hip flexor stretch. I actually prefer it in standing, but I usually teach it in a half kneel like this. The key is that you don't let your pelvis spill forward like this individual in the orange shirt on the very far right. She looks as if she's much more flexible than Dr. Kling here, but she's really not. The reason she looks more flexible is that if you were to look at her pelvis, it's tipped forward. So like if it's a pitcher of water, everything's spilling out of the front. So she doesn't have any more hip extension than Erin does. She's just letting her hips spill forward. So when you're doing this exercise, you have to tuck your pelvis under this dowel in the back. You basically would want to like flatten your back into that dowel. Okay. Doing it in standing kind of takes the guesswork out of that, because when you do this in standing, you would put your front leg up on a step. That rotates your pelvis back for you. So there's a video of that on our YouTube channel. It's called the standing hip flexor stretch. That's the one I give and I do more often, but I always show people how to do this one in case there's not a step. I think it's important that you understand why you're tipping that pelvis back. Okay, so last little bit, we're gonna do a running mechanics seminar, I think in July, right, Kelly?
Yeah, mid-July.
But I wanted to give you guys some things you should at least be thinking now. Form is important. You'll hear me say that, I'm really adamant that I don't want to box runners up into a one-size-fits-all approach. We're all different. If we were to compare all 10 or 12 of us, whatever there is, we're going to find some people that are really flexible, some people that have longer tibias compared to their femurs, some people that have wide hips, narrow hips. Those things all, you learn how to move within the confines of the body that you are given. So, you'll see different variances in run form, and that's because for some differences in run form are due to the way that we're built, and some of them are due to our speed. So speed does matter when it comes to run form. There's certain things that you should see people doing the faster they're running. One of the problems with run form is that essentially what you'll read is taken from elite run form. These individuals are running very, very fast. So we take elite runners, they have very good run form, and then try to apply that across the board to runners that are running an average pace, which averages for a half marathon is about 11 to 12 minutes a mile. So I wouldn't expect somebody that's running a 12-minute mile to look like somebody that's running a 4-minute mile. They're not going to look the same. And so I think it's important that we don't try to box everybody up into that. So I always talk about that. But when it comes to speed work, there are some things there's not a lot of debate over. When it comes to speed, just think about this. Speed is essentially a product of stride rate and stride length. That's all it is. The amount of times that you cycle your legs multiplied by the length of each stride equals how fast you're running. That's all there is to it. Now, you can get yourself into trouble when you start to increase that stride length too much, which is what we all like to do when we get fatigued. Now, that doesn't mean that I want the stride rate to be through the roof, right? But stride rate is cadence. When it comes to form, you want to maximize stride length and maximize stride rate to run fast. One of the take-homes with the stride length is that you want to avoid overstriding. You want that stride length to come from your power, your pop, your drive. You don't want it to come from reaching out in front of you. That's how people get hurt. When you reach out in front of you, it puts a lot of stress on the hamstring. It also, if you think about when you hit the ground, if you're landing really far out in front of your body, if you hit the ground's going to push back against you. There's literally a ground reaction force vector pushing back against you from your foot up towards your body. And the further you are out in front of you, the longer that lever arm is going to be, the more leverage you're going to put on your hip, your knee. So you want your stride length to come from your knee drive, from driving your knee forward, not reaching your foot out in front. When we get tired, if we haven't been taught this and haven't worked on it, we all reach with our foot out in front. So you'll hear some individuals say, well, you should just land on the ball of your foot without question. You can do people a disservice by doing that without education. Landing on the ball of your foot will get you to land closer to your center of mass or your center of gravity. However, you transition about 44 body weights per mile from your proximal muscles down to your calf and your Achilles when you do that. So it's not wrong, but you can get hurt. You could develop Achilles tendonitis very quickly if you just transition to a forefoot strike. The other thing is that when you're running on the ball of your foot, there's a pace at which it becomes more metabolically efficient. And we think that that's at about a 6:30 pace. So if you're not running at a 6:30 pace, then running on the ball of your foot, like if you're running at a 9-minute pace, you actually may be slowing yourself down. There's some research that shows that a gentle rear foot strike with a shoe on is more metabolically efficient. The take home is that you don't want to overstride. So visuals are better. I'll do a little bit more of this kind of work and talking in July. But the key with running fast is to avoid overstriding, maximize that stride rate, turn it over, and stay light and compact. So what is light? Basically don't hit the ground hard because it's going to hit back just as hard as you hit it, right? And then compact, what does compact mean? If imagine you're watching yourself from the side, try to stay as compact as possible and avoid reaching out too far in front. That will start to feel more efficient as well. So we're talking about cadence or stride rate. You've all heard that probably that cadence should be 180. That's not necessarily true. That's taken from a research study that showed that there was never a race won at a cadence of 180 or less. I would never argue with somebody that says that 180 is good for injury risk. That's not wrong. You're never going to get hurt by increasing your cadence. But there's this, everybody has this kind of peak in their cadence. Like if you're used to running at a cadence of 155, if you bump it to 180, you may be slowing yourself down. We all have this peak where we're most metabolically efficient, and it's usually a little bit higher than what we like to do. So historically, I'd like to run at a cadence of 160. If I'm doing like a tempo workout, 172 to 175 is most efficient for me, but it's also probably the best combination of efficiency and injury prevention. So why does cadence work? This graph on the left is the y-axis is your force, your ground reaction force. The x-axis is when you're on the ground, from stance, from initial contact to when you toe off. And you can see there's a peak. Well, that peak is because as you hit the ground, your ground pushes against you, right? And then as you come off the ground, that ground reaction force dissipates. So why does cadence work? These two graphs over here on the right, the one on the top is this is crude, I drew this, but it's just for illustrative purposes. The one on the top is if an individual has a cadence of 155 steps a minute, they're hitting the ground with 2.5 body weights per step. So that would be 387 body weights per minute. If you increase that individual's cadence to 165, so shorter, quicker steps, now same pace, that's important for this purpose, they're going to decrease their ground reaction force. They're going to take more steps, but the ground reaction force is going to go down. So the research shows that when you do that, yes, they're taking more steps, so there's more peaks and valleys, but the area under the curve is much lower. So if the 165 times 2, you've gone from 387 body weights down to 330 body weights per minute. So that's why Cadence works. And it does prevent injuries, but it's important to know that like if you're historically a 12-minute miler, 180 shouldn't be necessarily your goal. If you've been struggling to keep up with 180, well, there's a reason for that. It's because it's not efficient for you. So with Cadence, there's always going to be this blend of economy and injury prevention, and where that crosses is kind of up for you to kind of feel. Generally, it's around 170 for most runners, 165 to 170. So for runners that are capable of running in the 6s and 7s, then yeah, 180 for the speed work is probably what you should be aiming for. But don't put a lot of stock in that number. It should change as you run faster. Okay, so what are some safe strategies I can try today? I'm going to wrap this up. Just 2 more slides here. Efficient, quick steps. So increase your cadence, decrease your stride length. Okay, get that stride length from your knee drive. Don't get it from reaching out in front. When you get tired, you'll notice that that foot will start to swing out in front of you. It's because it's easier, but it doesn't mean it's better. When we sit, we like to slouch. The reason we slouch is because it's easier. We don't have to do any work. It doesn't mean it's better for us, but it's the same kind of thing. It's just a postural compensation. So you want to perceive that you're landing underneath your knee slightly bent. Maintain good posture. I can show you guys more of this next time or in July. Maintain efficient arm swing, and think run light, relaxed, effortless form. The product should be an effortless, the perception of effortless form. And the reason is, remember that as you hit the ground is hitting back against you. And that's what causes injuries, is that ground reaction force. So here's one of my favorite videos of Kipchoge running. This is just kind of after I was talking about this is illustrative of relaxed, effortless form. He's running at about a 4:30 pace, 4:35, 4:38. So for some perspective, that'd be like a 70-second 400. And it doesn't look like it. He's very smooth and efficient. You'll notice he's getting his stride length from his knee drive. He's not landing out in front of his body. He's maintaining arm swing. He's got good posture. His hips are driven forward. He's not overstriding. He's got a long stride length, but he's not getting it from reaching. Most of us would not be able to keep up with him for very long. And we all don't get the perception that he's working that hard, this form. So he's also very gifted. All right. I'll go back to this. Stop sharing. Anybody got any questions or anything? Sorry if I went over.
Lee, I have a question about driving up the knee.
Yeah.
I've been running for about 7 years now, and didn't do distance running before. And I would guess I was always under the impression that it's more about the compactness and the quick cadence and the kind of the back kick, but not. I guess I equated driving the knee with reaching out.
Yeah. So it's a good question. I understand I'm following you. So like if you're the back kick, the knee drive can still incorporate back kick. So let's say in your head, your gait cycle starts right when you're about to toe off. This back kick, what is this? This is knee flexion, right?
Yep.
So if you think drive your knee forward, that creates flexion as well. That hinges your knee when you drive forward. When you create back kick like this, that creates delay in pulling your knee forward, which actually can create overstriding. You don't want to think pull up this way. You want to think pull this way. And then the knee should automatically fold underneath you. And the faster you're going, the more it's going to fold because of momentum. So if it's running like a 8-minute pace, it may look like this, 8-minute pace, 7, 6, 4, like that. So as you create more knee drive, because of that, the motion of your leg, your knee is going to fold, foot's going to fold up underneath you because of this. Now, there's nothing wrong with teaching knee flexion. I shouldn't say, I mean, there's some types of running, like pose running and chi running, where they'll teach pop that foot up off the ground like this first, right? But you still want to encourage knee drive along with that, particularly with speed work. So, and the reason is that if you drive that knee, the knee flexes and the foot stays back. You want the foot to stay behind the knee as you come forward, then it comes down underneath you instead of this, which this is what we like to do when we get tired.
Yes.
Just swing that foot forward because we don't have to use our core and our hip flexors. So that's essentially why there's the angle between your femurs right here. Imagine this leg is back behind me. That's called your stride angle. The higher your stride angle, the lower your overstride angle will be. Your overstride angle is how far your tibia is pitched forward. Okay. So this is stride angle is your femurs. This is overstride angle here. Yes. The higher your stride angle, the lower this will be. Okay. This is a good thing. It's really all about the knee. You want the tibia to be relatively vertical when you approach the ground.
That's helpful, Lee. Thank you.
Yeah. That's a good question.